morning. This is Dr. Sai Ravi Shanker. I am a senior consultant cardiologist, Continental Hospital. We are doing all the intervention cardiologist as of now. So I am here practicing for last 17 years in my cardiology practice. MDDM, FSCC. So doing all the intervention, and we are dealing with all hypertensive, diabetic, cardiomyopathy and heart failure patients. We have a dedicated heart failure clinic also is there. Is the inability of the heart to pump effectively to maintain enough blood flow to meet the body's need or the weakness in the pump function of the heart. So that means it's the result of abnormality in the heart, which result in impaired ejection fraction. So ejection of the heart. So that means it can be some pumping dysfunction or diastolic or relaxation. So heart means it's pumping and relaxation. So heart pumps and relaxation. So if it is a pumping problem, then we will call it is a systolic heart failure. So now new term is heart failure with reduced ejection fraction. That is the new term. Now with normal pumping action also, patient may develop heart failure. That's what a new terminology is, heart failure with reserved ejection fraction. Previously we thought that when the heart pumping action is down, then only patient will develop heart failure. No, even though the patient's pumping action is normal, most of the time what we are seeing in India is even though the heart pumping action is normal, they can even prone for the heart failure like hypertensive with diabetes patient, where their pumping action is normal. What we call is heart failure with preserved ejection fraction. There is a measure in between, that is intermediary preserved ejection fraction, but that is a very rare. So in India, approximately, if I talk about in India, 2% of the adult population are having heart failure. So heart failure may increase the risk of hospitalization and then a situation. The most important is this patient which is having uncontrolled hypertension. That's what is the most important. Uncontrolled diabetes, and those already having a heart attack and underwent a PTCA or bypass surgery. These are the most important persons. They will land into heart failure. So uncontrolled hypertension, diabetes, those are already having a heart attack or underwent a PTCA stent. At that time, these are the most. Some of the patients, those are having, this is in the adult, even in child, those are having shunt lesion where birth defects will be there. They are also risk of developing heart failure as well. So these are the very important is how to recognize the heart failure and how effectively, immediately early recognition of the symptoms of the heart failure. That is a very important thing. So what are the early recognition? Means shortness of breath is the very important first and foremost sign. Patient might develop breathlessness while walking. That is the first symptom. Then while sitting also while sleeping patient may develop. That is the very important thing. Paroxysmal nocturnal dyspnea is the most important symptom. Then abnormal fatigability, swelling of the feet and swelling of the face are the most important feature. Patient may develop palpitation. So most important is the breathlessness. Who are at risk developing heart syndrome? So these people has to consult the doctor as early as possible. And few of the blood tests, which most important is the biomarker called NT-proBNP, and we have to do the ECG, echocardiography to find out any diastolic dysfunction or to find out any systolic dysfunction, and we have to do some of the biomarker which I have told. These are the very important thing. And if you early recognition of the symptom, then you can start the treatment early. So the recovery chance is early. Yeah, there are so many new forms of the heart treatment for the heart failure. As such, heart failure is a very serious disease, but it is manageable by only three things. One is lifestyle changes, second is optimal medical management, third, we have right now with the advanced therapies for the heart failure. So significant progress has been made in terms of new drug to treat the heart failure and supporting device therapies, which will helpful for the patient for having a stable life and carry out their day-to-day activity. Now the recent drug ARNI, which has been very clearly shows that 33% reduction in the sudden cardiac death and 30 to 40% reduction in rehospitalization. So new drugs emerged and new advanced therapies also emerged. So somebody is of your loved one have been diagnosed with heart failure recently, please consult a cardiologist with a dedicated heart failure clinic. They will tell you how to manage the heart failure and what are the new therapies for the heart failure. We have so many new therapies like ECMO, LVAD, new therapies for the heart failure that is available in India. Those are already having a heart failure, I can reassure you, heart failure is easily manageable with optimal medical treatment and lifestyle modification. Simple few things, a trick like salt intake is a very important factor. If you reduce the salt intake and if you quit the smoking and tobacco, whatever, these are the two important things, and properly maintain your blood pressure and diabetes, which is a very important factor. If you maintain proper medication, stop smoking and salt intake reduce, fundamentally 30 to 40% can be manageable by this. Then routine monitoring of the heart failure is recommended at any cost with your doctor. An important medication for the heart failure, so whichever recommended taken, you have to take regularly. Routine visit to the clinic and evaluation by the doctor will helpful monitor the progress, prognosis, and it will modify the treatment. So these are the very important things you have to manage if you are already having a heart failure. You have to make your heart stronger by yourself. If you are in what way? If you are diagnosed with diabetes, hypertension, or which I have already told, you had a heart attack, these are the signs and symptoms of the heart failure of like recent onset of breathlessness, abnormal fatigue. If your legs are swollen or face is swollen, then immediately consult the doctor. A cardiologist, immediately consult the doctor. If you are diagnosed with heart failure, ensure you make necessary dietary and lifestyle modification, which already I have told, low salt diet and quit smoking. And then understand your medication. What are the medication you are taking, why you are taking. You please understand your medication. Some of the diuretics, aldosterone antagonist, some of these ARNI which I have told, beta blockers, these are the very important drugs for the long-term heart failure. So nothing to worry. If you are already having a strong, already having a predisposing factor, please, and you have developed any of the symptoms, please consult the doctor as early as possible. Thank you.